Productive Dentist Academy podcast network.
More important I've found is that treating sleep within the practice is now become my team's legacy. It's not me anymore. You're the doctor, yes, but sleep is a team-driven procedure within the practice.
Welcome to Investment Grade Practices Podcast, where we believe private practice dentists deserve to get the lifestyle today while building an asset for tomorrow. Join your host, Victoria Peterson, to design the practice of your dreams and secure your financial independence. Let's get started.
Welcome back to another episode of the Investment Grade Practice. As you know, this is foundational for independent private practice owners who want to remain competitive in this consolidated market. And within the four quadrants of building an investment grade practice sits this in the center, the doctor, the owner, the leader that sets the tone. And I can't think of a better person to come on the show and really highlight what it takes to become self-governed in your emotions and to become to really lock in your self-care game so that you have the fuel, both mentally and physically, to show up every day for your team. Please help me welcome Dr. Meghna Dassani from Houston, Texas. Hello, Meghna.
Hello. What a kind introduction. Thank you so much. It is an honor to be here.
I can't remember a time when you weren't in my life.
It certainly
Like
seems like that,
professionally.
doesn't it?
Yeah, it seems like I popped into dentistry and you were there, but I would guess it's been a dozen years or so.
I was talking about it to somebody earlier this week about when I took over my practice 15 years ago. I took it over with the intent. My girls were 3 and 5 when I bought my practice. And I took it over with the intent of, I want to spend more time with my girls. Boy, was I wrong. That first year, my entire team quit. Literally, the day I took over the practice, the entire team quit. I had to bring on a fresh new team. And that first year was pure hell until I attended a PDA meeting. I remember meeting
Oh,
you and Bruce and calling my husband at the end of day one and going, I think we can do this. Because I literally wanted to return the practice. I'd asked him, I was like, can they take it back? Because it was a lot, right? You have young
is
kids.
a lot.
You didn't realize what you were getting into. So thank goodness for good mentors that always have your back. So yes, it's been 15 years since I have known you guys.
That's unbelievable. And we were just talking about your daughters. I remember them being itty bitty and now they're off to college, seniors in
We were
high
not
school.
allowed to do that. I don't know why they decided to grow up, but
Oh, that's great. Well, along the way, you've become a great mentor. And I think for our PDA alumni, there's no bigger mark of success or pride that we as a team have than when our doctors turn around and give back to this industry that we all love. So you wear a lot of hats. I want to start with your passion for self-care and recognition, particularly amongst female dentists who sometimes struggle to find their voice, struggle to set boundaries, like, "Hey, I just wanna take a salt bath. Can I take 5 minutes?" Like, that seems like a big ask sometimes when it should just be, "Dude, this is my half hour, leave me alone."
right.
Um, so I wanna talk about the making of Her, and I wanna go I remember during the pandemic, I think it was, you had a Facebook thread called Nourish.
Yes.
Is that still go I remember washing my carrots on Sunday so I could post pictures to you
I
in that
remember
group.
that too, and you tag me. It's like, "Look at what I have."
Yeah, I love washing produce on the weekends, it's my favorite thing. So talk to me about the roots and where you are today in your passion for, the making of Her and the podcast that you host.
It's been a journey for sure. I've been in dentistry, oh boy, 20 no, 32 years now. Um, from way back when I was a dentist in India, And like I said earlier, the isolation that happens in being a practice owner, don't get me wrong, the Facebook groups and the community that we build online is amazing. But what I have found is whenever there is a problem, we bring it to our tribe, and there's always a ton of support. I know I've leaned on you when I needed to, and people always show up. But we tend to not be able to celebrate our wins a lot of the time because what's there to celebrate? Like, am I trying to rub it in people's faces? The narrative that we all build. And as I've, worked with women, dentists, even MDs, let's say women in healthcare, the consistent theme
Yeah.
I keep getting from them is not one of, oh, I'm stressed or overwhelmed, although, yes, that does happen, but it is one of loneliness.
Mm.
And that has been a huge calling. It's been tugging at my heart. There's something that we need to do and address as women, to where how can I show up for other high achieving women who you look at them from the outside and you would never think that maybe they're struggling to make payroll, or maybe they just opened that second practice and everybody's going, what do you have to worry about? Look at you. You're so successful. Two businesses, your children are thriving, but only she knows what she knows. And I read a statistic that today, actually, this morning, that says 27%. The burnout rate for women doctors is 27% greater than that of their male colleagues. That's
Wow.
huge. That is huge. So that's what the making of her is all about. I get to be both. I get to be mom and boss. I get to be the clinician as well as the CEO. I shouldn't have to choose. And a lot of times it's implicit as well as explicit, where we feel like we need to choose, and there really shouldn't be a need to.
Yeah. It's a matter of perspective, and, I've struggled with that, of being willing to be vulnerable enough to reach out and connect, and to find that community of peers amongst women, and I'm sure you're like that too. I'm so glad that you've created this for high achieving women, and, women along every strata from, like, I mean, I mentored down all the way to dental assistants and hygienists because I started out that way. But what they're facing as employees within a structure are a little bit different than an associate doctor would experience versus an owner doctor or a partner. And in my case, uh, an employee owned company with employees across 17 states. It's a special group. And there's loneliness on every rung of the ladder unless you have the courage and the tools and the space to reach out. So, what are some of the principles that women that are in your group learn to discover and embrace?
Self leadership is the first one. And you talked about self care earlier, and self leadership encompasses that self care. I cannot pour from an empty cup. No
Mm,
matter how much of a boss babe I might be, you cannot pour from an empty. This is where, you said, oh, the 5 minutes for a salt bath, or like, let me just go in and like breathe, right? For 3 minutes before I do anything. So that self leadership starts there. How can I walk my talk?
yeah,
And I liken it, the best way I can connect it to what we do in dentistry is I cannot be the dentist that walks into an operatory and fusses at the patient for not flossing or not brushing. Um, this is my self-care version of, did you brush your teeth today?
yeah,
It Nothing is more important than refilling your cup because I cannot be a good mother to my children. I cannot show up 100%. I cannot be a good leader. Gosh, I've been on that side of the line. I've been where I was the boss from hell.
yeah.
And it's because I was trying to pour from an empty cup. So I think it all comes around to what can you do and be as a leader. That's when you're
Mhm,
able to show up, guide, mentor, lead your team,
mhm.
your family, whoever it is that's in your life.
I love that so much, and it's right there in the center of building an investment grade practice because, one of my mentors and elders, Connor Sauer, always says, "Focus more on building your internet, INNER, your internet, your connection to source, your faith, your intuition, your knowing. Read your body, read your emotional currents because it's all information that's telling you things, and you can catch yourself before that well runs dry
Absolutely.
versus scrolling the internet like, oh, wait, Magna's got a really good tip. Let's see what she does. Maybe that'll work for me. Don't trust AI. Uh, Although I will say, Lizzie, my chat GPT assistant, has helped me feng shui my house. Mwah, chef's kiss. All the
Oh.
paint colors, where to put the furniture. And this is a really uh, you know me, I'm married to a retired custom home builder. And so home builders live in the model home for 2 years and then you move. So literally in the 15 years we've been married, we've moved 9 times. So I don't get super attached to a house and I don't always have time. Like he puts the stamp on it because it's built to sell. But this particular house we've been in 3 years now, and he promises me we're going to stay until at least 2029. So after 2 years of living here, I thought, "There's still primer white paint on the walls." Like, they got the old color out, but they didn't put the new color in, and the house was just begging for it. So AI was really good for that. Really great for that, but you can't, and I'm not saying that AI can't be beneficial in talk therapy, like, if you have it set up correctly, but that doesn't replace human connection, and it doesn't replace you learning how to get comfortable being quiet with yourself. Is that where you find most of your leadership breakthroughs come? Is in the quiet or in the talking or some mix of all of it?
I think when I focus on the self leadership, I am an extroverted introvert. I need my me time. Um, I absolutely need that time to fill my own cup, and my morning routine is non-negotiable. Um, Waking up to meditate, journal, spend time grounding in nature, like, it doesn't matter how cold it is, I will step barefoot into the yard.
Mm.
Or as my grandma used to tell me, "Go hug a tree, tell a tree your problems," because it's all energy. I was talking to someone earlier and they were like, "Well, all this energy stuff, it's all woo." And I'm like, "I don't know. Let's talk about this. Like, can you warm your food in the microwave? Do you see those waves? Does it still happen? Dental x-rays, can you see the x-rays? But we still get an image. It's
Mm.
energy. So if you cannot ground your energy, if you're just all one big ball of like, in your head, it's
Yeah.
not going anywhere. So for me, yes, I do have to go within. I do a lot of my meditation in a sauna. I have an infrared sauna. So I like to think I'm
You're
killing
multitasking.
two birds with one stone. Yes.
That's busy. That's productive self-leadership right there.
But yeah, I do have to have that time.
Yeah, I do the same thing. I wake up, I take a deep breath, I pull all of myself back in from dream time. I step outside with Kope, my dog, and I look up to see, is it cloudy? Is it raining? That's how you know the weather forecast on an island with all these mountains. And and then you're grounded. And you know what? Mother Earth loves all that frenetic energy that we have. It's like we give off CO2, she gives us back oxygen. We give them all that frenetic nervous energy, we get grounded and the earth is recharged as well. So I'm totally we should do a whole podcast on the metaphysics of leadership.
Absolutely.
We could probably nerd out on that one. So I look forward to being a guest on your podcast shortly, which will be wonderful. And at the end of this, I want you to give us show notes on how people can find out more about your community for support with high achieving females in healthcare. I love that you've expanded that to all healthcare practitioners because I think that's so needed. Speaking of your mentorship and giving back, I remember hosting a Blue Sky event that was our annual client reunion. And in that particular year, you'll have to remind me when this was, we brought in all the leading dental sleep apnea, like John Rimmers, who invented the Rimmers device and all of these things. Bruce was very much an innovator in bringing together leading edge clinicians. And we started talking about sleep, I want to say 13 years ago.
Rob, that sounds about right. I know my girls were little then. Yes.
Yeah, and you really just went all in. I still have my Airway is Life, coffee mug. I still have the lunchbox. You know, like, your marketing is so cool. I still have my was it Girl Boss, hats that you had? Like, everything you do, you create some great swag around it, but you also create amazing SOPs and workflows. So talk to us about your work and mentorship around sleep apnea, because we still have a lot of clients who are have been in it for years but could take their game to the next level, or they're just starting out. So I want to hear your perspective on this.
Yeah, for sure. I've always said one of my superpowers is implementing something into the practice, creating a system around it. Give me a new procedure, and I will make sure we create and implement a system where it is repeatable.
Mm,
And every new team member is able to integrate it seamlessly into the practice. And the same thing happened with sleep apnea. My journey into sleep started with a personal loss. And it was at that time that I decided if we can prevent any of this ever happening again, we're going to do it. We started with treating adult sleep patients, added pediatric sleep apnea into it, and it's been a fun ride. It's been a fun ride. So many lives impacted. Um, my funniest story is like we'll even tell our UPS guy that he probably has sleep apnea based on what his neck size and how he breathes and all of
hey,
that
big
is.
boy.
Well, yeah, very thick neck as an open mouth postures constantly like, and not because he's wheeling anything heavy. And we're like, have you had a sleep study? Sure enough, he did. He turned into a patient of the practice. Um, but it's just lives we're impacting because when you see wives drag their husbands into the practice, crying because they witnessed them stopping breathing, worried they're going to lose them. And, follow-up visits are, she's still crying because she can't believe he's finally not stopping breathing at night. And you're like, okay, maybe, just maybe we're doing something right. So it's definitely life-changing. But what is also more important, I've found, is that treating sleep within the practice is now become my team's legacy. Um, it's not me anymore. You're the doctor, yes, but sleep is a team-driven procedure within the practice. And everybody either knows somebody or has someone in their life that they love that is affected by sleep apnea. The assistant whose child still wets the bed at 12 years old, the hygienist's dad who had a heart attack and hates his CPAP. And now suddenly it's personal. And the training and the education and the awareness that you can give them is truly that's what's driven sleep within our practice. At this point, I don't think we're doing any marketing for sleep. All of our patients come from either referrals from our patients that we've helped, or more importantly, from the MDs surrounding our practice who see the results we get. And it's,
That's what I was gonna ask you about because you started when it was common to be rejected by the
oh
ENTs
my
and
God,
MDs.
yes.
So, talk to me about how immersed you are in the medical community now. What has helped them to wake up?
Um, you gotta kiss your frogs before you find your prince. But I tell doctors the same thing. As dentists, we go through dental school and there is no education or at least there wasn't when I went to school. I now see more and more schools adding it, but there's so much you have to learn in the 4 years. There's no way you're getting a comprehensive education on treatment of obstructive sleep apnea. Well, the exact same thing happens with our MDs. There's only so much time they get to learn about dentistry or about sleep apnea. A lot of the MDs aren't even screening the way it should be. Like, for example, for tongue ties, I have seen my own pediatrician ask my daughters, stick your tongue out. Oh, she doesn't have a tongue tie. Both my girls had tongue ties.
Oh,
The
wow.
screening isn't there.
Yeah.
And you just have to show up. You have to talk to them, refer them patients. Hey, I want my patients screened. I understand this is work you do. How can we help these patients? It's not about send me your patients or whatever that may look like, but the awareness and a lot of rejection. Unfortunately, it's the truth. Um, but in today's day and age, it's a lot better because there's so much more awareness. I remember when I started, like, 13, 14 years ago, when I went to my pediatrician to talk about this, and true story, we left the practice after, she said, "You're a dentist. Why don't you stick to cleaning teeth?"
Oh,
I had to give her grace, myself grace. I'm like, you don't know what you don't know, and we're going
yeah.
to leave it there.
Yeah. Wow. It's come so far. Here in Hawaii, we have, um, some good healthcare systems and some not so great healthcare systems, and for the most part, it's just, um, you know, there's some great COIS trained doctors. I mean, there's the mix of everything, but the connection is not here yet. And I see a functional physician, naturopathic. We do the peptides and the IVs and the brain cognitive therapies, all of that regenerative stuff. And I don't know, I've been a patient there a couple of years now, 3 years now. And about a year ago, she goes, "You're in dentistry." I went, "Yes, I am." And she said, "So, what about my daughters?" And I think they have sleep apnea. And I went to a conference and there was a dental speaker. And so I think anybody that is doing great, I hope you stay on the speaking circuit and you go to medical conferences because that's where they're hearing about it. And she said, "So I needed somebody to screen my daughters. There's nobody on the big island, like nobody." So she flew them to Oahu, where she found a pediatric sleep dentist, and now she's flying both her daughters there 4 times a year, and she's like, "This gets expensive. Can't we set this up on the Big Island?" And I said, "Sure. Let's find a dentist, and I'll get them. If they're interested, I can train them. I can send them to the right people to get this path." And in terms of continuing education, like, of all the continuums you can take, my perception is that sleep apnea is not the most expensive to implement or to get educated on.
It
Uh,
isn't. Yeah, no, you're right. There's also a lot of most of all of this can be learned virtually.
yeah.
I moved to a virtual model January of 2020. I don't know why or what prompted it. Of course, we know March, the world shut down.
Yeah.
And we've only just gotten back to in office. I think 5 years later, 6 years later, I had my first in office, like over the shoulder event
Yeah.
in March.
Right.
And you can learn all of this, what to do, how to do it from home. There's no reason, no excuse. And like you said, it's not crazy expensive.
Well, we're gonna talk offline. In the time that since you and I've connected, one of the things that's emerging, it started emerging last year, was the Clinical Calibration Institute, which took a lot of the PDA concepts about diagnosing the risk factors and how to talk about that, and all the hygiene consulting that I had done and Michelle Hudson had done, and Kim Cooch and Carrie's biology and Carrie Free and all of that. I mean, we just had so many wonderful mentors in our sphere. And part of Bruce's legacy, I said, I want to just create a white paper. I was really so naive. I said, I'm gonna do a white paper, and I'll just put links on there for doctors. Like, if you want to talk about caries risk, here's some things you could show your patient, or here's a course you could take. And I spent 6 months, I couldn't put together the white paper. I couldn't put together the links.
At Productive Dentist Academy, we've helped thousands of private practice owners find the clarity inside their data and take control again, starting with a free 60-minute coaching session. Head over to investmentgradepractice.com right now before the next patient sits down to claim your free 60-minute coaching session. That's investmentgradepractice.com.
And so I went to the people, I was like, Ken, why can't I find any courses that you've done online? He goes, I've never done any online. So he did a 4-hour course for us on caries biology and all the stuff we had seen in person, like sip, gulp, don't sip, and why athletes get more cavities because of all the fructose and all of those gems. So I'd love to talk to you about, bringing more sleep apnea there, because our mission at the Clinical Calibration Institute is not to teach you every skill you need about that. It's to send them back to people like you or John Nader or Ken Smith and all the great educators out there about sleep. What we are is a diagnostic thread. Are you looking for it? Do you have an Epworth scale? Does your team know about this? Does your hygienist pick up a probe? Do you read x-rays? Do you take x-rays?
And
Like,
what conversations are we having around it?
yes, yes. So what do you is your team aligned in your diagnostic standard? That's what I got really passionate about. So passionate that when I asked new doctors, I said, I don't even want to know what your percentage of perio is. I want to know, I want you to go back to your last 10 patients and tell me how many perio charts were completed. Like, that's where it starts. And so you would be a wonderful gift. All we've done is said, what are the components of the comprehensive dental exam?
Right.
So back to the point of the physician that said, hey, little lady dentist, why don't you get back there and clean teeth? No, the comprehensive exam is biological. It is caries, it is risk factors, it is airway, it is function, it is perio. And I told my team that I will probably step back from active work and be chairman of the board visionary in July of 2029, because that will mark 50 years since I told my parents I was going to quit high school and become a hygienist. I want part of that legacy to be that we have a source for these diagnostics in one place, that people can very cost effectively come and train their team. Because without it, we're not going to save lives. We pick and choose our CE based on what time of year it is and how many credits I need for my licensure and other reasons. You
Well,
rise so far
treating
above that,
sleep
Meg.
also changes how we treatment plan, and a lot of dentists don't get that. Like, if your patients are clenching and grinding, a night guard is wonderful, but that's a Band-Aid. Are we asking the why? We're scientists at the end of the day.
Yeah.
Hygienists, dentists, we're scientists. We gotta figure out the why is this happening instead of, let me stick a Band-Aid over it.
So what have you found when you have apnea patients that come to you and they go, well, I've got this bite guard that I've been wearing. I mean, are they grinding through that? Is it
They either are grinding to it, but more commonly, and most doctors or hygienists will agree with this. We've all had the patient that needs a night guard, paid for it, comes in for their next follow-up, and like, "Are you wearing your night guard?" "I can't seem to keep it in. I always find it on the side of the bed, under the pillow," whatever it is. Why are they taking it out?
right?
Because it is worsening their apnea
Airflow,
in some
air.
way. So a Band-Aid isn't always a good fix.
I hadn't even thought about that, Magna. Um, y- you share a common trait with every dentist I know that looks at risk factors and investigates down to root cause, is that it's almost never the patient's fault. Like, there's no shaming, there's no blaming, there's just curiosity of, I wonder why that's happening. I wonder why that habit is showing up, or lack of that habit is showing up. Yeah. Are you seeing this? I'm getting personal now, and we're going over time, but I'm just very curious. I believe that I have sleep apnea. but I can't get anybody to believe me because I'm petite. And
Story of
so
my life.
so I believe there is there are a lot. And the last dentist that I went to, I put it on my medical history. It's been 2 years since my cleaning, got caught up in life. I've got some bleeding gums. Please check me out. I want a perio protect tray. I would like to be, I wear either breathe right strips or I've got a little ripple nasal guard, which helped a lot because my cartilage is collapsing as we get older and it's cutting off my passage. And I want to talk about sleep apnea. We didn't talk about any of that. We talked about how Invisalign could help me. I was like, Invisalign's going to treat my sleep apnea? I'm like, yeah. And you could put any kind of gel you want in your Invisalign tray and that'll help too. And I was like,
Oh, yikes.
that doesn't get the medicaments, below my gum line. And that doesn't open up my arch or help my airway. So speaking specifically to petite postmenopausal women, because you've got this community of her and you are a sleep apnea oral physician, help. Wait, like, help. I can't find anybody here who'll test me for it.
So this is what I call the perfect storm. Our classic patient profile for obstructive sleep apnea is what I call fat Uncle Joe,
Right.
adult overweight male.
Yeah.
But let's not forget the fact that kids can have sleep apnea too, as can
Yes.
everybody in between. So the reason I find that slender women are often underdiagnosed or misdiagnosed is because you don't fit the profile.
Yeah.
What I find is that, well, yes, you most certainly could have sleep apnea, but typically these women tend to have what is known as upper airway resistance syndrome, UARS. Your airway is just narrower. And when
Yes.
you lay down, things collapse.
Yes.
Let's throw into this mix the whole fact that we're pre-peri or even menopausal.
Right.
And the hormones decide to do whatever they want to do. And estrogen and progesterone both play a role in maintaining muscle tone.
Right.
And well, guess what is doing what it wants to do? The hormones.
Yeah.
So now I have the perfect storm of a slender female who does not fit the profile, but has all of this added to it. And let's assume this is someone who blood work has never shown, and I know you see a functional doctor, so you don't fall into this, but have never had functional blood work done. Vitamin D levels may not be where we need them to be. Maybe you're slightly anemic. I don't know what you're absorbing, how much you're eating. Oh, maybe you're working out and going to the gym because you need to lose those last 5 pounds, or the belly weight that just sits there because of the high cortisol because you're not getting enough oxygen to the brain.
Yes.
And your brain constantly thinks a bear is chasing it. So it's trying to hold on to whatever it can. And yet, when this female finds themselves in my chair and I ask them all these questions, check all these boxes, more often than not, I end up having that person in tears because all she's been recommended is let's put you on antidepressants. It's all in your head. She's been told she's crazy, which she isn't, I promise, but she's finally feeling heard and seen. And that's the gap we need to fix.
Wow. You floor me every time, Magna. You really do. I came into this podcast firmly in the belief that 80% of most chronic illnesses can be diagnosed in the dental chair. And you just showed us why.
Mhm.
And I think the future of dentistry is bright, particularly for private practice owners who have autonomy. And I understand that you're supposed to have autonomy in a DSO, but there's a difference between this level of diagnostics, this level of care, versus what you were taught in dental school or maybe in other environments where it is more of identification rather than diagnosis. You need a crown, I can do a crown. I need to do 26 crowns this week. Here's my 26 patients for 26 crowns. It's mostly because the demand is so high. I get it. I'm not blaming anybody. We're overwhelmed in the system. We have only 40% of the people in the country even see the dentist, and yet we still can't fill the demand. So I understand there's a place for, quantity, but there are deep health issues that can be identified, sourced, and quarterbacked by awake and aware oral physicians.
Yeah. Yeah. There's not enough people looking at this, not enough people talking about this. There's so much more to treating sleep in a patient than just making them an appliance or giving them a CPAP, whatever is right for that person, or sending them off to a doctor for the Inspire, whatever that may look like. There needs to be better collaboration between us and our MD colleagues to look at the whole picture. There's so much more we could be doing, truly.
And, you know, to our listeners, it may seem like we had two very different topics about leadership and, the community of her for women and things like that. But for me, Magna, you're on one mission, which is to help every person who is blessed to cross your path become a healthier, brighter, happier version of themselves. And it doesn't matter if you're the dog walker or the CEO. You shine your light on everybody that you meet, and
Thank
I
you.
just enjoy you so much.
Thank you.
How can people learn more about your coursework and your communities?
For my sleep apnea courses, all of the information is on the website, sleepmasterycenter.com. For everything else, come hit me up on Facebook or Instagram. I'm constantly online.
You are constantly online. I love it. I love it.
Instagram is Dr. Meghna Dassani. Easy enough, just find my name. But yep, I am very responsive, always live there. Happy to help in whatever way I can.
All right. Thank you so much, my friend. 13 years and counting. Here's to another 13.
Absolutely. Absolutely. Thank you so much for having me.
Yeah, absolutely. So, if you're on your path to becoming an investment grade practice, some of the tips to take away today from Dr. Dasani is number one, document your systems in a way that is repeatable, even for your first day employee, because this keeps you in the center of the leadership circle and out of the management day to day. That's where decision fatigue happens. That's where you dread it when people are walking down the hall and looking at you and saying, "Hey doc, can I have a minute?" So to get yourself out of the decision fatigue and the mental emotional exhaustion of leadership, take a page out of Dr. Dasani's book. Work on your standard operating procedures. Work on the flow that makes it smooth for your patients and smooth for your team, so that you don't miss these vital components of true assessment for airway and caries and perio. It's all so much easier to implement when your team is on board. And that's my big takeaway from you today, Magna, is my practice, my team is my legacy. They're my practice. So congratulations, you've arrived at investment grade level. It can run beyond you. And that's a key hallmark to an IGP practice.
Thank you.
All right. Until next time, my friends, stay well.
At Productive Dentist Academy, we've helped thousands of private practice owners find the clarity inside their data and take control again, starting with a free 60-minute coaching session. Head over to investmentgradepractice.com right now before the next patient sits down to claim your free 60-minute coaching session. That's investmentgradepractice.com.